welcome everyone. My name is Ben. Thank you all for coming today. Today we'll be covering hands-only CPR as we will be teaching others. The guidelines we'll be using is the Red Cross. Basically, what I'm going to be doing is I'm going to be training the trainer on hands-only CPR. Now, getting started, the greatest fear of everybody, basically the general public, is they cannot perform hands-only CPR well enough to be able to make a difference. We're getting ready. Let's take a look at this video and let me know after if you would feel confident just watching this video being able to perform CPR.
To you, harmless game of charades based on film titles turning into a sudden cardiac event? Bam! Shaklaki! No? What? Think you're better than me? Well, it happens, all right? It's a real-life situation! Got my daughters here? Call 911, push hard and fast, okay? Focus! And yes, the beat of staying alive really works. Disco can save lives. Yes, disco, huh? Check it out. What do you think? What? Dance party!
Alright, so over that video, it gives you a general idea. Me personally, if I just had to go out and do hands-only CPR on somebody, I wouldn't be very comfortable doing that. It gives a good general layover, but I mean, starting with the first question, does it address any fears? Not really. It just tells you the general push hard and push fast, push on the center of the test. It doesn't really address how or why you're doing that. Does it cause injury? Generally, you can have some bruised ribs at most on the victim. Is it safe for anybody to do? Yes. Are you liable? No. And what we'll be covering in the next couple slides is how will you know who needs hands-only CPR. The breakdown of the steps is step 1 is unresponsive, step 2 is calling 911, step 3 is the positions of the victim and the rescuer, step 4 is the open airway, step 5 is the hand placement on the sternum, step 6 is the two-handed technique, step 7 is the depth and the rate of compressions, step 8 is when to stop, step 9, if the victim starts breathing, position of safety, and step 10, confidentiality. We're going to be breaking that down step by step in the next few slides. Basically, with an unresponsive victim, you're going to, depending on how they're laying, you're going to be gently tapping their shoulder, kind of giving them a little gentle shake, asking if they're okay, and listening to see if they're groaning or making any sort of noise. And if they're not, you will start to begin CPR, hands on. Before you restart, make sure to call 911 and stay on the line to make sure that you can give them your address or where you currently are, give them some sort of landmark. And if you're the only one there giving CPR, just put your cell phone on speaker by you so you can keep the operator updated on what's going on. Depending on make sure you have to be very aware of the position of the victim. Depending on how you find them, if they're on their side or on their belly, make sure to gently roll them over, and to make sure they're on their back, flat on the ground. And you as the rescuer needs to be on the side of the victim. As far as next part is make sure that the victim is lying flat on their back like this, and you'll be opening the airway. Make sure to lift their chin so that way their tongue actually does not get in the way. As far as where the compressions are, you will want to find it on yourself to give a good example, but here's a skeleton to be able to show you. Obviously right here is where your throat is. Find right here at the bottom of the sternum, so that way you'll know exactly where it is, and as you do the compressions you'll be able to keep the heart pumping. As far as how you want your fingers and placement is basically hand over hand with the top hand interlinked so that way it's here. And as you do the compressions, you want to make sure your arms are locked and you're pushing down on that sternum. You should be able to feel some sort of give a little bit with the ribs as you're doing that. As far as, and this just gives you another word placement of what I just covered, as well as this one. The depth and rate of compressions, as the previous video said, push hard and fast. You want to give the rate of about 100 per minute, and they honestly gave a good example of the Bee Gees Staying Alive. Old classic, I know. When to stop. There are two different instances of when to stop. It's either when the paramedics arrive or if the victim starts breathing. When the paramedics arrive, that's the only time. If the victim is not breathing still, they will arrive and take over. If the victim starts breathing, however, you want to turn them on to preferably their left side, so that way if something happens and they either vomit or something happens, they're able to expel whatever is in their throat. Obviously, confidentiality. This is a form of a medical procedure, so you should not talk about this with others. And then here's the Red Cross demonstration of how we should be doing it.
How to perform hands-only CPR. Cardiac emergencies can happen anywhere. Be prepared with a simple technique known as hands-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. You will need the willingness to act and a few simple skills. Whenever possible, use disposable gloves when providing emergency care. Step 1. If you see someone suddenly collapse, check the scene for safety and then see if the person responds to you by tapping them on the shoulder and shouting, "Are you okay?" Step 2. Briefly look for breathing. Step 3. If they don't respond, call or send someone to call 911 or the local emergency number right away. Step 4. If the person is not breathing or is gasping, prepare to give chest compressions. Kneel beside them and put the heel of one hand on the center of their chest. Place your other hand over that hand, lacing your fingers together. Position your shoulders directly over your hands, keeping your arms straight and your fingers off the chest. Step 5. Push hard and fast, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Step 6. Keep going. Do not stop compressions until the person shows an obvious sign of life like breathing. The scene becomes unsafe. An automated external defibrillator or AED is ready. You're too exhausted to continue, or a trained responder takes over. Step 7. Get training and encourage others to do so by taking an American Red Cross health and safety course. Knowing full CPR, chest compressions, and breaths will enable you to help in other emergencies such as drowning and choking. Every household should have at least one person trained in life-saving skills. Did you know? Most people who survive a cardiac emergency are helped by a bystander. To find your local Red Cross chapter, visit redcross.org.
Alright, so obviously by that video, it gives you a little bit more in-depth compared to the previous video of how or when it is necessary to use. Now, in front of each of you should be the Red Cross guidelines. So far, does anybody have any questions? Alright. So, with the guidelines, it's pretty simple. We're going to take our mannequin here. Everybody should have one. We're going to put it directly on the floor to make sure we've got the hard surface covered. Make sure to lift the chin a little bit. Line up the shoulders right on top. You should be able to hear, at least in the mannequin, that air pumping. Alright, so I want to see each of you do this real quick for me. And as I'm watching you do it, if I see anything that needs to be either moved or placed differently, that'll be easy enough to correct. Awesome. We've got a volunteer to come up to the front and give us a demonstration.
Okay. Are you okay? Are you okay? I don't think they're breathing. Call 911.
Perfect. That's perfect form too. All right. Thank you for volunteering. All right, and then one other thing I should have handed out to each of you is a teaching record that I want all y'all when we meet next week. Basically, you're going to be going around to anybody who wants to, you want to teach, and try to get this filled up. We've got about 20 names. I want to see at least 10 to 20 on each one, and get a little feedback from them, see how you did. And again, my name is Ben. Thank you so much for coming in and taking this time to come see us. Yes, a question.
I have a question about the first thing up here. I know that before we start our class, we're teaching 3 people that we're familiar with.
Correct.
Does it matter the ages of those people?
No, not at all.
Can
As
I
long as
teach an
they're,
8th grader?
as long as, oh yes. As the Red Cross video said, anybody can perform it as long as you have the ability to be able to perform it correctly. So maybe somebody like elderly or that does not necessarily have the strength to be able to put behind them. Because when you do it, you want to make sure as the video said, you want to make sure your shoulders are squared up over the person's chest and you're putting as much of that upper body weight behind it as you're pressing down. All right, any other questions?
I have also a question that has been asked to me when I said I was coming to the class. Is this effective? I looked it up, and it said it was. It said you have enough oxygen in your body if you just keep it circulating. Is that true?
Absolutely. It's just making sure that the blood is continuing pumping. That's why our blood cells are red, because oxygen is actually taking up, moving the blood pumping into the entirety of our body and through the bloodstream. As long as you keep that blood pumping with the oxygen in our blood up to the brain, there should be no mental side effects whatsoever.
I saw in the Red Cross video it said, wear gloves. Lay people are not going to have any gloves, so I'm assuming we should avoid talking about the gloves. I mean, it'd be nice if you had them, but who's walking around with those?
Well, that's actually a really good question. Generally, not everybody's going to wear gloves, but it said in the video, if you have them on you, yes. But I mean, you're right. Generally
There's no
speaking,
blood involved, you're going to be all right, I would think.
Correct. I'm thinking they're trying to just cover more of the situations where, like if there's some sort of, like they've vomited on themselves, or there are cuts or gashes or anything, to make sure there's no contamination that way.
Yeah. Well, I'm not going to emphasize that in my class.
All right. Any other questions today? If not, that is awesome. Thank you all again for coming to my class, and I look forward to seeing y'all next week. Y'all have a wonderful day, all right? All right, welcome back everybody from the lunch break. My name is Ben. It was nice talking to y'all during the break. We previously covered the hands-only CPR. Easy enough. Today, this segment after the break, we'll be covering the AED part, which stands for the Automated External Defibrillator. What does it do? As far as the AED is concerned, it actually shocks the heart and continues to pump, helps to continue the heart pumping the oxygen to the brain. We're going to watch a short little video right here. And it'll give you a little bit better understanding.
This oceanside Verbo is about to become the backdrop for an unforgettable vacation memory. CPR alone won't restart a heart. It keeps the victim alive until an AED and medical help arrives. Most importantly, an AED should be used as quickly as possible. Survival can depend on it. An AED, or Automated External Defibrillator, is a portable, user-friendly medical device used to treat someone in cardiac arrest. It's designed for use by lay rescuers without medical supervision. That's you. An AED will automatically diagnose abnormal electrical heart activity that causes cardiac arrest. An AED treats cardiac arrest by delivering an electric shock to the heart called defibrillation. This stops the abnormal electrical heart activity and allows a chance for the heart to function normally. The AED analyzes the heart's electrical activity through electrode pads applied to the chest. Defibrillation provided by an AED is highly accurate and effective, but you have to act quickly. Since most of us, fortunately, don't run into these situations every day, modern AEDs have CPR feedback technology and are recommended by the latest international resuscitation guidelines. They provide real-time feedback for depth and rate of chest compressions, which allows rescuers to know how well they're performing chest compressions. It guides rescuers with prompts and a real-time bar gauge to the recommended depth and rate of chest compressions set by the International Resuscitation Guidelines. Remember, doing CPR and using an AED are both critical in a sudden cardiac arrest. In our next episode, we'll show you exactly how all this works.
Alright, so as that video showed, it's pretty easy. It's easy enough for everybody to use. Placement is easy enough. Actually, a little fun fact, when I first started taking this, as it showed in the video, it was easy enough to just lay something on the chest and it folded out where the pads go. Now, as far as where you can find them, it's not legally mandated that any place uses them, shopping malls or schools or anything. Most places you can find them are common enough. Everywhere you can find one just about anywhere. OSHA does not mandate them, but you can still find them everywhere. Restaurants, businesses. You can probably find one in this building. You'd be surprised. Make sure to look for it on your way out after class. And as far as the step-by-step, we're going to watch another short video right here. To give us a little bit more in-depth of how one is used.
Every year, thousands of people die of sudden cardiac arrest.
She's unconscious. Go to the front desk, call 911 and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use. An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyzing.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
In shock, move away from the patient.
Make sure that no one, including you, is touching the person.
Red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades.
using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised, everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
Alright, so pretty simple enough as the video shows. With the infant, it's a little weird. You would think of how that crossbody electroshock would affect them, but that's actually because of how it is on the infant's body. It actually, the cross shock will go straight through the heart. Are there any questions so far? All right, let's continue.
We have a handout with these steps. We're going to review that.
Absolutely. Thank you for bringing that up and reminding me. Here's the guideline right here. As far as AEDs go, you can find them just about anywhere. The person performing CPR will dial 911 and send somebody else to retrieve the AED. And as they're working on that, they will continue CPR until the AED will tell them otherwise, because they have to be able to analyze the heart rhythm to determine whether or not they have to deliver a shock or not. As far as the guidelines go, we've got this right here. Everybody should have one. It'll have the cords on it. You should be able to plug that directly into the AED so it can analyze the heart rhythm. Obviously you have to stop CPR as it analyzes. So obviously remember, up in big highlighted yellow words, you have to make sure it's completely wiped down and dry to attach the pads to the victim's right and left. Now, adding on to this segment of the class from the previous one, what can you see as possible barriers?
I see one as being able to access a trainer. Now, I understand we're going to be able to check those out from you, that some are being ordered, so we'll have some new ones and we won't have to worry about if it's working or whatever.
Well, as far as going out and teaching the community to be able to follow along this, yes, they are on order. Unfortunately, we just couldn't have.
Well, we have something here today, but we'll have new
Absolutely,
ones for us
yes.
to use. Okay.
Thank you for bringing that up. So, obviously, the victim, as you're continuing CPR, pressing hard and fast, as we learned from the last segment, somebody else will come with an AED. They will open it up as you're continuing CPR. You open it up, pull everything out. You're going to have pads and everything with cords attached to them that you attach both to the pads and to the AED itself. And as it described in the video, you'll attach everything in. The person doing CPR has to step back for a second and let the AED itself analyze the heart rhythm to see if a shock is necessary. If it is, it'll say stand back, do not touch the victim, and it'll deliver a shock. If it says no shock is needed, it'll say continue CPR.
Well, another thing I could see is maybe with older people, they would think, I'm a little bit scared of this, it's shocking. But if I'm thinking about teaching to maybe scouts or to high school people, they're going to like technology. They're going to not be afraid of this. So I think it
Well-
can be a barrier, but I think sometimes it'll be exciting to them.
Well, as it stands right now with technology moving forward, yes, it absolutely, especially with how it shows in the video, it's a lot more user-friendly than it actually seems, because it talks to you. It tells you how everything's supposed to work with the victim. So,
And I think they'll like the feedback that it says you're doing good.
exactly. All right, so I'm going to begin CPR. Does a volunteer want to help me out with an AED? We'll start with that. Are you okay? Are you okay? No? You, call 911, go grab me an AED. I'm going to start CPR.
I have the AED.
Perfect.
I'm opening. It's on.
Pads out.
Okay. One's here. One's here.
All right.
It's on. It's connected.
Stand
Stand
clear, let it analyze.
Shock delivered.
Perfect.
And you would give this for 2 minutes or 5 cycles. Okay.
Absolutely correct. Thank you so much for volunteering.
Okay.
All right. Perfect. I'll grab that from you.
Thank you.
All right. Now that that's given, obviously, if we had an practice AED here for everyone, we would be able to. I would go around and make sure everything was proper form and everything was correct with all y'all. Thank you so much for being here. Again, my name is Ben, and I'll see you here next week after you give me some more feedback about who you taught on how to use an AED and with hands-only CPR. Again, thank you so much for being here. We'll see you next week.